That
All right. What's up, guys? This is our family throughout history presentation by Alberto and Josue. Okay, so for this project, we were assigned to come up with a family, and basically for our family, we chose to have a grandmother. Her name is Maria. She's 62 years old. And she handles taking care of the kids when the parents are at work. And for our parents, our father, the father that we came up with, his name is Gabriel. He's 42, and he works as a general contractor, and he has 10 years of experience. The mother, her name is Leticia. She's 40 years old, and she works at the county office and she's also has a focus on social work. They have three kids. The oldest is Yvette. She's 17 and she's a junior in high school. And she takes care of her brothers, and she also helps around the house with her baby brother. The middle child, his name is Gabriel. He's 16 and he's a sophomore in high school. And sometimes he goes with his dad to work on the weekends. And then last but not least, the youngest, his name is Andres. He's 3 years old, and his grandmother and sister take care of him when his mom is at work. So our family is a middle class family, and they live in a medium social economic status of a neighborhood. Any neighborhood like these, they contain a community center. There's a nearby hospital, and there's also parks with rec centers and a bunch of other stuff. And one thing to know about where our family lives is that there are no nearby grocery stores, and there's a lot of access to fast food instead of healthy organic options. Our family after COVID, our grandmother, the grandmother in this family, she's still alive, and she still lives with them, and is scared of contracting the virus due to her immigration status. um Gabriel, the father, he unfortunately is out of a job and he's now stuck at home. The mother, Leticia, still works at the county office, and she is now working from home online. The daughter, Yvette, she's still a junior in high school, and now she does distant learning, online school, and so does the middle child, Gabriel. And the baby's still the same. He's healthy and he's still being taken care of by his grandmother and his sister. Our family's external environment after COVID. So after COVID, most parks were closed, and community centers were brought down to a very minimum, and the hospitals became overcrowded because of all the people that were starting to get sick. According to factors related to COVID-19 vaccine intention in Latino communities, they said public healthcare systems were already strained before the pandemic, which with scarce healthcare providers and long wait times, especially in rural settings. Perez 4.
so COVID affects our Hispanic family. According to factors related to COVID-19 vaccine attention in Latino communities, they said Latino individuals are often uninsured or underinsured because of immigration status and employment with limited benefits. The risk of losing employment because of the pandemic would also result in losing healthcare insurance. So, as we previously has said, the grandmother is an immigrant and the father's out of work, and therefore, those are two discriminatory factors that are affecting them. Because of her immigration status, she has a fear of seeking medical attention in order of being deported, and the father who's out of a job will lead to financial insecurity within the family, and also health insurance insecurity. And then some strategies to help Hispanic families. According to the article, it said further investments in culturally appropriate programs in coordination with local healthcare providers, advocates, and stakeholders is needed to reduce health disparities. So again, allowing communities to take care of each other to create a stronger community and to create specialized programs to focus on them, to focus on their needs, and in order to make a stronger community as a whole. And then next slide. And another quote was that health outreach programs such as VDS have been key to disseminate information about the virus, testing, healthcare navigation, and handling of the disease. And it's basically an organization that is associated with the Mexican government to help Mexican communities in the United States, to help underprivileged communities. And because a lot of with the insecurity of being an immigrant comes also the insecurity of modern medicine, and just that they need to seek and to seek out help. Next slide. So in conclusion, with Hispanic families during COVID, they deal with the stress of their immigration status as well as their family members, and that leading into financial trouble with our family. And communities need to understand that everyone's socioeconomic situation and citizen status shouldn't deter someone from seeking help for their health. And these are our resources. Thank you for listening.